Hi, my name is Dr. Hendersonville and I am a family medicine physician here at Blue Ridge Health. In this video, I would like to talk to you all about the benefits of vasectomy. Vasectomy is often a form of birth control that we overlook, whether that's due to fear of potential effects, questions about how is it performed, where is it performed, questions about the procedure and how it works, or how much it costs. Our hope is that this video can answer some of those questions, ease some of those fears, and demonstrate what a safe, effective, and low-cost option this is for birth control. The first thing to know about vasectomies is that they are considered a sterile procedure, which means they are considered permanent. Though you may have read that it is possible to reverse a vasectomy, a reversal is incredibly expensive, not always covered by the insurance, and not always effective. So if you and your partner are considering having children, then pause this video and come back to it later. For those of you who have already completed your family, let's talk about how vasectomy stacks up against the female version of permanent birth control, the tubal ligation, or getting your tubes tied. Both have a failure rate of approximately 0.1 to 0.5%, or approximately 1 in 1,000. However, the procedure for your partner to get her tubes tied is performed in an actual operating room, which requires invasive surgery by going through the abdomen and also uses medications to put them to sleep. This allows for an increased risk for major complications such as procedure-related death, as well as a dramatically increased cost. In fact, in a 2011 and 1989 study, they found that tubal ligations were 20 times more likely to have a major complication and roughly 4 times more expensive when compared to a vasectomy, respectively. At this point, you may be thinking, well, what is a vasectomy and how is it performed? Well, let's talk about it now. Here at Blue Ridge, we perform what is called the no scalpel technique vasectomy. This means that no surgical knives or scalpels are used during the procedure. We utilize this technique because it has been shown to have fewer complications such as postoperative pain or bleeding, to cause smaller vasectomy scars, and to allow a faster recovery time. An important part of this is that we do not perform these procedures in an operating room, but instead in a room just like this. The steps of the no scalpel technique consist of locating your Vas Deferens, the tube that carries the sperm from the place where they are made in the testicles to outside the body with ejaculation. Then we deliver plenty of lidocaine to numb the skin and the area surrounding both the Vas Deferens in order to make sure that you do not feel any pain during the procedure. Next, we make a single small hole in which both Vas Deferens can be grasped, and then create a divide between your Vas Deferens. To divide the Vas Deferens, we don't just cut them, we actually fully remove a small section about 5 millimeters in length. We cauterize or burn the inside of the two ends of the Vas Deferens and clamp each end with a metal clip. This is all in order to help prevent reattachment of the two open ends of the Vas Deferens, making it more likely to be a successful permanent procedure. One question that comes up frequently is whether vasectomy will affect a man's ability to have an erection or have sexual intercourse with his female counterpart. The answer, thankfully, is no. There are false rumors associated with vasectomies and erectile dysfunction. This is simply not true based on the location and how vasectomies are performed in today's time. Testosterone, the hormone our testicles produce, is largely responsible for all of our masculine or manly characteristics, as well as our libido or sex drive. Testosterone does not rely on the Vas Deferens for transport. It enters directly into the rich network of blood vessels that supply blood to the testicles and is carried to all the places that need it. The only purpose of the Vas Deferens is to carry sperm. So by removing part of the Vas Deferens, we are not interrupting any part of the sexual cycle, only preventing sperm from being present in your semen. We usually do these procedures on a Friday morning, and generally men only need to take it easy for about 48 to 72 hours. After a vasectomy, Tylenol and ice packs are generally the only thing that is needed for pain control. By Monday, most men are ready to go back to work. And let's be honest, a vasectomy is a great excuse to lie around on the couch for a weekend and catch up on that show that you've been trying to watch. So let's quickly summarize what we learned in this video about vasectomies compared to their birth control counterpart, tubal ligations. Overall, they are safer with fewer complications and a lower risk for death or mortality. Vasectomies are performed in an outpatient clinic as opposed to tubal ligations, which require an operating room and anesthesia. Vasectomies are cheaper. They generally have an easier and faster post-procedure healing time compared to tubal ligations. However, remember this is considered permanent. If you're going to go through with a vasectomy or tubal ligation, you and your partner should be at the point where you do not desire to have any more children. If you have any additional questions or want to talk more about vasectomies, please call Blue Ridge at 828-692-4289 to schedule a vasectomy consultation today.